Welcome to my YouTube channel. I am Dr. Satish Yograj, a senior medical specialist and a holistic consultant. Today in this video, I will talk about a very crucial and important aspect of heart health, and that is stress management. For those dealing with heart disease, understanding and effectively managing stress is not just beneficial, it is essential. Join me as I explore practical tips and insights to help you cultivate a calmer, heart-healthy, holistic lifestyle. Let's embark on this journey towards better stress management and a happy, healthier heart. The heart is a vital organ responsible for pumping blood throughout the body, supplying it with oxygen and nutrients. It is a muscular organ comprising 4 chambers, 2 atria and 2 ventricles. The heart maintains a rhythmic beat facilitated by electrical signals. Critical for overall health, the heart plays a pivotal role in sustaining life by ensuring proper blood circulation. Heart disease comprises a range of conditions affecting the heart such as coronary artery disease, heart failure, and arrhythmias. Risk factors include high blood pressure, high cholesterol in blood, smoking, and diabetes. Understanding and addressing these factors through lifestyle changes, medication, yoga, and regular checkups are crucial for maintaining heart health and preventing cardiovascular issues. Friends, let us talk now what is stress in today's fast-paced time. Why knowing about stress is so important for prevention and in the treatment of heart disease. Stress is the body's natural response to challenges or threats, triggering a fight or flight reaction. Normal stress, often termed as eustress, is a positive form of stress that arises from everyday challenges and motivates individuals to perform optimally. It can enhance productivity and personal growth, such as the stress experienced before a presentation or a deadline. Abnormal stress, on the other hand, known as distress, is excessive or prolonged stress that exceeds an individual's ability to cope. This type of stress can be harmful, impacting physical and mental health. Chronic distress may result from ongoing challenges like financial difficulties, relationship issues, or work-related pressures, leading to negative consequences such as anxiety, depression, and physical health problems. Recognizing the distinction between normal and abnormal stress is essential for adopting appropriate coping mechanisms and seeking support when needed. Especially in today's fast-paced, stressful world, understanding stress is very crucial. Excessive or chronic stress can lead to various health issues, including cardiovascular problems, anxiety, and impaired immune function.
Stress management is an integral part of a holistic approach to health and heart disease. Stress management involves various strategies to cope with and reduce stress. Ensure that you spare some time to meditate daily. There is no right or wrong way to meditate. The key is finding a practice that works for you. Try to set aside time each day to establish a routine and get comfortable with meditating. Even just a few minutes a day can make a big impact. Studies have shown that establishing a daily meditation practice decreases activity in the 2 regions of our brain called amygdala and the default mode network. Amygdala regulates concentration, memory, and emotions such as fear, anger, and sadness, while default mode network is to blame for daydreaming and wandering thoughts. Decreased activity in these areas with meditation calms your minds, thoughts and emotions. This reduces stress and you may experience a sounder sleep, less anxiety and a more positive outlook on life. This reduction of stress activates our parasympathetic nervous system or the recovery or rejuvenating system and lowers the levels of stress hormones such as cortisol, adrenaline and norepinephrine, which are linked with heart disease. So, integrating the practice of meditation into a daily routine has been linked to lower heart rate and blood pressure, which lowers your risk of heart disease and helps in your recovery if you are suffering from heart disease. There are many types of meditation that can result in healthy physiological benefits, such as guided meditation, which uses mental images to help you relax, transcendental meditation, which uses a repeated sound or a phrase to help you empty your mind, and mindfulness meditation, which focuses on the present moment and helps you to accept it without judgment. In various studies, meditation has been consistently shown to lower your heart rate, blood pressure, breathing rate, oxygen consumption, adrenaline levels, and levels of cortisol, a hormone released in response to stress. All this leads to a prevention of heart disease as well as undoing the blockages and damages in our cardiovascular system. Friends, another important activity which you can inculcate into your daily routine is yoga. Yoga has today proved to be of great benefit in preventing and managing heart diseases. Yoga is a mind-body activity that involves moving through a series of body poses and breathing exercises that improve strength, flexibility, balance, and gives relaxation. One of yoga's clearest benefits to the heart is its ability to relax the body and mind. Friends, worry and depression commonly follow a cardiac event such as heart attack, bypass surgery, or a diagnosis of heart disease. As part of an overall treatment plan, yoga helps you to manage this stress. Beyond offloading stress, practicing yoga helps in lowering blood pressure, blood cholesterol, blood glucose levels, as well as your heart rate, making it a very useful lifestyle intervention. One study had shown that waist circumference, a marker for heart disease, improved in middle-aged adults with metabolic syndrome who practiced yoga for 3 months. Another study has shown that slow-paced yoga twice a week reduced the frequency of atrial fibrillation episodes in patients with that condition. In another report, patients with heart failure who went through an 8-week yoga program showed improvement in exercise capacity and quality of life. They also had low blood levels of markers for inflammation, which contributes to heart disease. Yoga is one of the most effective ways to naturally reduce your cholesterol levels. Yogasanas or yoga postures which can be done in patients of heart disease are Vrikshasana or a tree pose, Uthita Hastpadasana or extended hands and feet pose, Veerbhadrasana or a warrior pose, Trikonasana or triangle pose, Utkatasana or chair pose, Adhomukha Swanasana or downward facing dog pose, Marjari Asana or cat pose, Bhujangasana or Cobra pose, Ardha Matsyendra Asana or sitting half spinal twist, and finally Shavasana or a corpse pose. Friends, some other lifestyle factors which are important in the management of heart disease are: make proper time management in life, organize your tasks and prioritize to reduce overwhelming feelings. Spend some time in hobbies, engage yourself in activities you enjoy to unwind and relax. Try to limit technology in your daily life, take breaks from screens to reduce digital stress. Always try to set realistic goals in life. Avoid overloading yourself with unrealistic expectations. Be good to your heart, body and mind. Do what makes you happy. Make sure that you are kind to yourself, your body and your heart by keeping stress levels to a minimum, practicing mindful conscious living and considering if your emotions could be affecting your heart health. Friends, self-care equals self-love, so stay heart-centered and focus on positive energy in your daily life. Be careful what you think because your thoughts run your life. Every cell in your body is constantly listening to your thoughts and your heart. Health comes from peace of mind, peace in your heart, and peace in your soul. This will help you greatly in remaining stress-free and will further help you in your recovery. Friends, a fourth part of the comprehensive lifestyle modification program which I recommend in my treatment plans to heart patients is to have adequate social support. Maintain strong social connections and seek emotional support from friends and family. Surround yourself with supportive friends and family and be mindful of negative thoughts and behaviors. A robust support network greatly helps in reducing stress and improve mental health. Friends, in the social support system, another important factor which I usually highlight during my treatment plans is love. Love, particularly love that develops into a committed relationship, can have a positive impact on overall health. Studies indicate that love impacts our mental, physical and emotional well-being in unexpected ways, and benefits include decreased risk of heart disease, lower blood pressure, improved immune health, faster recovery from illness and longer lifespan. Love is a stress buster. It is no surprise that having the support of someone who loves you makes it easier to cope with stressful situations. Being in the presence of your loved ones or even just thinking of them boosts your oxytocin hormone, which has been shown to lower adrenaline and cortisol levels.